recording them.
Good morning. Welcome to KSM CM lecture series. Having a continuous we are having even with this current situation. Now I want to tell you that in addition to the current audience here, the lot is connecting through our link. So the majority is not coming here because of the current situation. Even I was listening to this lecture last week. I was not here. So it is actually the majority is not joining through our link. So it's actually very good for considering the current situation. Today, actually, we are going to have a lecture. Something is missing. It's going to discuss by Dr. Vishaka Rajapaksha, our acting consultant, clinical hematologist, bone marrow transplant unit, NHSL Kandy. Vishaka is actually going to talk something. I was just wondering to see what is going to tell us. I'll start taking it further, and I'm inviting Dr. Rajapaksha to come and do the lecture.
Thank you very much. Yes, sir. Okay. Good morning, everybody. Thanks for presence here. I'm Dr. Vishaka Rajapaksha, acting consultant, clinical hematologist in bone marrow transplant and NHSL Hospital Kandy. But today I'm not going to talk about hematology or bone marrow transplant. This is something different topic, let's say. So we all are doctors, healthcare professionals, and we all are well trained to treat patients. Medical science is advancing with novel technology, and doctors are more knowledgeable than previous. But people believe that something is missing in our healthcare system. Communication between doctors and patient, personal connection among us, empathy, and compassion. This is something happening all over the world, not only in our country. Now it is kind of crisis by now. Let's see what is empathy. Okay, I'm sure you get the meaning of empathy. So let's see what's the meaning of compassion. Compassion is not just you feel others' pain or you could understand others' feeling. So it goes beyond that. So we'll see what is the scientific definition of compassion. Emotional response to others' pain or suffering involving an authentic desire to help. So you should have a desire to help others. So that means you try to do something for their worry. Maybe just touch, listen, hug, or just stay beside them. You can see these pictures, how they would show their empathy for their loved ones. Compassion or empathy or a kindness is a skill. So it's a kind of skill we should acquire during our lives. It's not just something inherited or born with. So there's a question: who is more empathetic? Who is good in understanding others' feeling? Male or a female? What do you think? Who is good in understanding others' feeling? So there was a study done by psychologists to test who are good in understanding others' feeling. They got two groups, men and women, and asked them to guess what others feel. You can get what was the results or yes, female had performed very well. So females could understand others' feeling than males. Then what researchers did, they got the same group and told, we will pay you for being accurate about others' feeling. So they will get money if they guess others' feeling correctly. Can you guess what happened next? Ah, there's no significant gender difference after offering money. So, my dear colleagues and gentlemen, you are still not hopeless. We all can practice empathy if we have a reason or if we want to do so. It is a challenge. Empathy is a skill. It can be developed and cultivated in our body. If we practice and practice empathy, it will become a habit. Eventually, there will be more empathetic people among us. And other things we have to remember that healthcare system is designed to treat patients and to provide care for them and not only cater hospital staff. So first priority should go to patient care. If you are empathetic, kind, or a compassionate healthcare professional, your patients are less depressed because patients know my doctor could understand me. Other than that, your romantic partner, husband, or wife will be more satisfied because you could understand them. Medical students, PG trainees, and all other staff around you are less stressed and happy. We are clinical leaders, so we have to understand others' feeling to guide them. But we can't be too empathetic and we can't be too tough. So we have to decide where should we stand according to the situation. I think we all have to learn leadership qualities. It is an art and something is lack in our training. I think it might be useful if KSM could arrange a leadership training program for doctors. It might be useful. And there's another question. Does compassion matter? Does it really matter in healthcare system? Or is there any scientific proven? Even though I said, you might think, do we have to think about compassion in healthcare system? So there's a research done with trauma experienced patients. They were asked what they could remember even after 5 years later of the incident. Obviously, physical pain at the time of impact, they can remember after 5 years. Same way, lack of compassion or the kindness from the healthcare worker. So even after 5 years of the incidents, they could remember the way we talk to them, the way we show our kindness to them at the time of impact. And there's another research done, and it showed 50% of Americans believe that their healthcare providers are not compassionate. So now it is a kind of global crisis. It is scientifically proven that healthcare providers spend more time on computers looking for investigations than looking patients. We are not looking patients' eyes. Sometimes we spend hours and hours discussing their cases with our staff, medical students, or PhD trainees, and uh, we order a lot of investigations on, but nobody bothered to explain what's going on with their mind. Do you know what patients feel? And they feel doctors or healthcare providers treat them as numbers, and they do not treat them as a person or human being. Does it really matter? Do we have to spend time with them? Or do we have time to talk with patients and their relatives? Time is limited and time is money. I don't know whether our patients are free to talk, even in our private practice, or we have time to listen them. Do we have time for compassion? So there's another research done in Harvard University in America and found 56% of physicians believe that they don't have time for compassion. That doesn't mean they don't have concern to their patient, but they believe that they don't have time to do so. Then there's another question. How long does it actually take for a meaningful expression of compassion? So there's another research done at Johns Hopkins University, and there was a randomized control trial in patients with cancer. Consultation by oncologist with compassionate way was compared with usual care. Primary outcome measure was anxiety. So that's pretty good because if you get a cancer, you are anxious. So it's better to measure it. Compassionate group use similar set of sentences at the beginning and end of their consultation. I will read it for you. So what they told to their patients, I know this is a tough experience to go through, and I want you to know that I am here with you. Some of these things I'm going to say today may be difficult to understand. I want you to feel comfortable in stopping me if something I say is confusing or doesn't make sense. We are here together and we will go through this together. So after the consultation or after the breaking bad news, they told, I know this is a tough time for you, and I want to emphasize again that we are in this together. We will be with you each step along the way. The conclusion was patients with compassionate doctor reported less anxiety. So it is scientifically proven that if we show that we are concerned and caring and we are here with them, they are less anxious. It was timed by researchers and showed that conversation took only 40 seconds. Therefore, it is obvious that only 40 seconds of compassion made a meaningful difference. So, my dear colleague, it doesn't take too long for a meaningful expression of compassion or a kindness. I will tell you simple techniques to begin with. Talk or listen, take time. It doesn't take too long, and touch. doctors touch and smile. It's a free gift or a valuable gift that we could offer for them. So don't lose that opportunity. But I mean appropriate touch and smile, otherwise there will be more complaint against healthcare workers. Anyway, it is scientifically proven as a powerful therapy. Just a tapping to their shoulder might be enough to show our concern. Let's see a small video. Okay, so we will see what are the benefits of compassion. So there was a systemic review done using thousands of scientific abstracts and 200 research studies and found there are effects of compassion or kindness on patient, cost of medical care, as well as healthcare providers. They found more than 20 distinct mechanisms of action associated with compassion. If you are a compassionate or a kind healthcare worker, we could provide higher quality standards of healthcare and lower the major medical errors. If anesthetics could talk to the patient preoperatively, their cost of pain might reduce. If patients are seen by kind doctors or compassionate doctors, it will reduce mortality rate in high-risk cardiac patients. Same way, it will boost the survival chance of cancer patients. There are neuroendocrine effects as well. There is some research done in diabetes clinic and found that more than 80% had optimal sugar control and reduced hospitalization rate due to diabetes complication. And also compassion has immune system effect. There was another research done in common cold patient and found there will be shorter duration of symptoms, low severity, and especially enhance their self-care. So we could apply it to our COVID patients. If we could provide kind or compassionate care, or if we could show that we are caring and looking after them, they might recover soon. And there was another study done in Johns Hopkins University in America using 1,700 HIV patients and found if patients know that you are caring and if patients know that physicians know them as a person, there's a higher chance of adherence to the therapy and more likely to take their medicine. If you could show that you could recognize him or her in a clinic or in the boardroom, it will make a big difference. Some research proved that compassion reduces the cost of healthcare system. If healthcare workers could spend more time with patients, need fewer diagnostic tests, fewer referrals to specialists, fewer unnecessary hospitalization, and lower the total healthcare charges. If we could talk to the patient, maybe we don't need so many tests. Why do patients refuse hospital admission? Why they request early discharge? It might be due to multiple reasons, but I would like to emphasize one of the most important concerns among them. Do you know how many child abuses occur in Sri Lanka or in this province? That father or mother might be a single parent or no one to look after their children at home. You can see the reported cases to National Child Protection Authority in Central Province, Kandy, Norelli, and Matale district. We all know vast majority of cases are not reported. Do you know majority of cases because of their own father, grandfather, or very close family members? Do you know how many pregnancies by their own father in Sri Lanka? I got this information from NCPS Sri Lanka, National Child Protection Authority. Now you can see majority of cases were against their own father and close relatives. Do you think they will come out these social problems unless we ask for? We are happy to talk about our proud culture and tradition, but better to keep in mind that these tragedies are happening under our sun and moon. That might be a reason to request early discharge or short break between treatment. They can't disclose all private matters to others. We have to be kind enough to understand their mind. Simple support might make a big difference. Just take social history or listen to their mind. If you know their burden, you might think twice before leaving the hospital. Trace their investigation reports, write a discharge soon. Because sometimes we think tracing investigations or writing a discharge is house officer's duty or somebody else. But if we know their burden, we might help them to do it quickly. Sometimes we might change our local policies, guidelines for their convenience. It might be his or her last request from us. Sometimes it's not affect significantly to their management or final outcome. The problem is we don't think from patient's side and we don't work as a team. Do you know what could happen if somebody hear a bad news? I will give famous examples nowadays. Can you imagine positive PCR results of COVID-19 or become a COVID suspected patient in National Hospital Kandy? You may not imagine because you are doctors and you are VIP and you have connection and you will be treated fairly. But can you imagine what could happen to others? I could give so many examples for bad news in the hospital setup. Could be a disease recurrence, spread of disease, failure of treatment, presence of irreversible side effects, or positive results of genetic tests. So many things can be happened, and you have to keep in mind patients, almost all patients having physical or psychological pains in the hospital. If somebody hear a bad news, they might follow 5 stages of grief and loss. They might deny at the beginning. They might request repeat PCR. They think doctor's diagnosis is wrong, or they might request second opinion, and they might get anger, depression, bargaining, or finally accept. These psychological changes among patients or their family members should be accepted by healthcare workers. So we should be able to understand their reactions and show our empathy, kindness, and compassion. Now it's high time for change. We are clinical leaders, healthcare professionals. We have to guide our staff and our society and our community. We should be more creative than previous. Let's see to next movie. So I'm sure you might have seen this quite old video clip, but it's just to remind you the power of words. Okay. Hope you gained something from my lecture. So please help me to find a better word for PPE because our healthcare workers think PPE is full body cover and then they are unable to do their proper job wearing it and have unnecessary fear. So if we could find a powerful word instead of PPE, we might be able to change National Hospital Kandy. Thank you. Thanks for coming here and thanks KSM for giving me this opportunity. Thank you.